You may remember back in the early days of the war, we had a memorable conversation with Anastasia Magerramova, and she is the press secretary of the largest children's hospital in the country, the Okhmatdyt Children's Hospital in Kyiv. Today, on this one-year day, we thought that we would reconnect with Anastasia. She's in the hospital again. Good morning. I'm delighted to see you again because we remember our conversation so well, the tour as well. Good morning.
Yes, hello from Kyiv, and we are happy to hear you.
Well, I'm happy to see you well and to see you with us. How is everyone doing there at the hospital today, Anastasia, on this special day? Are you thinking about it? Are you marking the anniversary? How are you doing there?
Everyone is working, but of course we are talking, oh, you remember this, you remember that. Someone was crying a bit because we have some traumatic memories from this time. And of course we remind it today. We remind our children and colleagues that we lost.
Well, let's talk about that, because no wonder you have traumatic memories. Let me remind people, when we were first speaking to you, you were providing care in the basement sometimes. The air raids were sirens were sounding and the bombs were falling. How have things changed in the hospital since then?
Yes, now in Kyiv it became better. We don't live in shelters now, but when we have air raid sirens, we go to the shelters. But now it's much better than it was before, in March, in the end of February. So now we try to live our life, we try to plan our work, and we continue to give medical care to children from all over the Ukraine.
And you're certainly thinking of the children you've cared for over this past year. Tell us a little bit about them. Are there as many children as there were then? Are the injuries the same? Again, what has changed?
In March and in February last year, we had a lot of injured people, injured children, families. Now we have less because Russian army not close to Kyiv now. But anyway, we have children from Kherson, from Mariupol, from occupied territories. So we have children with amputation. We have children with military wounds. We have children with bullet and mines. So we have children now from not from Kyiv and Kyiv region, but from Odessa region, Kherson region, where we have now active war.
Coming to you for those terrible injuries. You said you've lost children. What impact has that had on people in the hospital? Tell us about that.
Yes, we unfortunately lost some children. They died because of terrible injuries. And for us, it was also super traumatic and hurtful because it was little children, like 6 and 7 years old. So for us, it was really hurtful. And today we remind them, but also we remind children that we saved. And we are still in touch with some families. We call each other. They send us pictures. They are really grateful to our doctors, to our hospital that we saved, that our doctors, nurses, and team saved their lives. And we are still in touch. In next week, we will make a meeting with all families that we saved and that join this meeting, so we will be happy to see all of them.
That's going to be a very special moment. Everybody's coming back to the hospital to get together for a reunion?
Not all, but yes, most of them who is in Kyiv or who can come to Kyiv, they will come, and we will make a nice meeting for these families, for doctors, and these families and children. They said we miss you, we miss your hospital, we miss doctors. How are you? We are in touch in social media. They send us pictures, and we became as a big family with our patients, with our injured people and with doctors and nurses.
It's so lovely to see you smile as you think about the impact you've had on those families, saving the lives, because there have been so many sad moments. I know you wanted to share with us the story of not just the children you've lost, but you also lost one of your very special doctors over the past year in the war. Tell us about that.
Yes, unfortunately, we lost some of our colleagues. For example, we lost on 10th of October our hematologist. Her name was Oksana Leontieva. She was only 36 years old, and she was a super good doctor that treated the children with blood cancer. And a rocket got into her car, and she burned into the car on her way to hospital. She went to kindergarten and left her 5-year-old son, Grisha, and she was on her way to the hospital to save children's life, and unfortunately she died. And it was super hurtful for us and for patients, because they were waiting for their doctors, children, and she didn't come because a rocket killed her.
Probably she's very much on your mind today, too, this one-year anniversary day.
Yes,
You know,
of course.
yes. When we met you, Anastasia, you were living in the hospital because you wanted to be there in those early months to see everything that's going on, to be part of what was going on. You're not still living there, are you now?
No, now I am not living here. I lived here for 2 months on the beginning of war.
Yes.
With all hospital staff, because it was dangerous in Kyiv. It was dangerous to go home. And all of us lived here for almost 2 months.
Incredible. And you were doing, as you were living there, I remember so well, you were filming everything. You were documenting everything. You were posting the images of what was going on as a way to counter Russian misinformation. I remember you said it was like your own personal war, your own personal battle to make sure that the real stories got out there. And you thought that was a very important part. I'm wondering, here we are 1 year, what impact do you think that had? And do you continue to do that and think it's still an important battle to wage with this misinformation?
We continue to do it because we want the world to know the truth, and we see impact. For example, yesterday I had a call to mother of our patient. His name was Yura. He is 14 years old boy from Bucha, and his father was killed on his eyes in Bucha in March. And this woman said to us that she went to Gaga, and she said that I'm grateful that you filmed everything, that we had materials on international media and on Ukrainian media, and they used it also for this court. And she was really grateful, and we believe that it's also important part of war. Information war, it's also important because we know the truth. We see this patient, we see these people that are suffering from war, and we want to help them as we can, as doctors, as nurses, as press officers. So I try to do on my position what I can do and how I can help people.
Yes, you are living and seeing the truth of war and sharing it with us. Thank you for coming back to talk about what has been happening at your children's hospital and sharing the stories. Very glad to see you there, Anastasia, and continue to wish you good health and all the best as this continues under such difficult circumstances. Thank you very much.
Thank you. We are grateful for your support. Thank you.